MOJO Pelvic Health is a women-owned and operated physical and occupational therapy group who specialize in pelvic floor issues and wellness based out of Memphis, Tennessee, with locations throughout the Memphis region and in Jackson, Mississippi. For too long, pelvic floor issues have been considered a normal part of being pregnant or postpartum, or a normal part of aging. But this group is working to change the stigma around not only normalizing care for issues, but including pelvic health care as a normal part of wellness, and to help prevent issues that can impact how you see yourself and how you live your life. They treat women, men, children, and teens for any and all things that most consider to be TMI. Learn more at mojoph.com or on their Instagram at MOJO Pelvic Health.
This one's for the mothers. You gotta love the mothers. And you gotta hug the ones who bring us joy and love. It's the middle with the moms and it's your day. I said now this one's for the mothers. You gotta love the mothers. And you gotta hug the ones who bring us joy and love. It's the middle with the moms and it's your day.
Whew, I thought the kids would be gone. They're
morning.
here. Thank you for being so chill.
Yeah, oh my gosh.
All right. Well, Ellen, thank you so much for coming on. We have met before. Like, I was pregnant with my last one and filming you and recording you for the videos, and you did such a great job. Were you new? Were you just like newly working there, or had you been there for a while?
I've been there probably 2 years.
Okay.
I'm on year 4 right now with MOJO.
Okay. Ugh, love MOJO. But you are a mom of a cute little 7-month-old,
Yes.
and you are a pelvic floor therapist, and you have probably saved so many people's lives with this thing that I had no idea what it was, like no clue. And I'm so thankful that my OB, after I gave birth to my first daughter, was like right, like I think like she was like working on me. Like after I gave birth, she was like, "You're going to go to pelvic floor therapy." And I was like, okay. I was like, I didn't even remember really she said that. And then I was like, she told me something. But thank God she did, because not all doctors, really know about it or recommend it. I think it's becoming more popular, but it is just a game changer, even for people who aren't pregnant. So I would just love for you to talk about your journey, maybe in becoming one or learning about it yourself, and then tell our listeners, what it is and who it can help, who can benefit.
Absolutely. So I became interested in pelvic health when I was shadowing to come into PT school. I heard that we could help women with leakage and mainly I think it was bladder issues that I heard about. And I was like, oh, wow, as a physical therapist, you can like help with that. And I just was really interested in it. And then I went to UT Health Science Center here in Memphis, and one of my bosses, Sarah Lynn Johnson Foltz, she teaches at UT, and I met her there, and I was just fascinated again. Like she was talking about how it ties in the pelvic PT ties into back pain and hip pain and like the whole body basically. And again, I was really interested, and then that's right when MOJO was being founded, and I was hired out of PT school. And really from then on, it's just so fascinating to me that we can help with so many different things, whether it's pregnancy, postpartum, pelvic organ prolapse, back pain. We treat a lot of men too. So constipation, urinary leakage in men, like there's just so much to help with. And I'm really interested in it and learn more every day.
I love that. I'm going to turn this towards you a little bit. Could you hear it like
Yeah.
a little bit?
Yeah.
I think we'll be good now.
Okay.
But I love that, because it's when you're working with someone, especially when it's kind of medical and, health, you want them to love their job and be curious and to like continuously learn, because you're constantly like the world's constantly changing, medicine's constantly changing. And so the fact that you're interested in it still and love it is just a great thing.
Yes.
Well, that is so cool. Well, I'd love to hear about, so who hired you? Was it Amy or
Amy and Sarah Lynn?
Okay.
Yeah, yes. I met Sarah Lynn first, but
Right.
then during my interviews, like met Amy and I was trained under Amy and Sarah Lynn equally, and
right.
I just respect both of them so much. And looking back, even right now and forever, like when I met Sarah Lynn at school, I was like, I want to be just like you. Like, I just want your brain. And then I met Amy and I was like, I want to be just like you. So even just last week, I was thinking, okay, I try to take what they both have told me and taught me into my practice with a lot of my patients.
Right. And
providing, Sarah Lynn is very orthopedic driven, and I try to take that into my practice, and then Amy has a lot of trauma awareness and trauma therapy and somatic therapy, and I use what she has learned in my patients as well.
That's incredible. Taking best of both worlds.
Exactly.
I love it. You've actually worked on a lot of my friends. I'm not going to say who they are, but you've done a great job because, like it truly saved me. Like Amy saved my life. I say that every time I talk about her, but I learned so much from her, and like I take things like still to this day like that she's taught me. And I'm just so thankful for it. And she just was incredible. So shout out Amy. And I haven't met Sarah Lynn, and I know that she's amazing too.
Yes.
But what I also love is like the things that pelvic floor can help are things that some people think that they're stuck with the rest of their life. They think that they're just going to have to deal with this. I hear so many women, like on the older side be like, yep, I pee my pants all the time. I jump and pee comes out, but that, I had kids and that's just how it's going to be. And I'm like, sometimes I hold my tongue because you can't always, just jump in and give advice to people you don't know. But sometimes I'm like, pelvic floor therapy.
Yeah. Have you heard of this?
Yes. And, with men, like the same thing, like, it's a little more, I feel like it's harder to get men in to see you guys. Cause it, it's a very personal thing, and you gotta have the right person. You gotta feel comfortable. But, there is a man in my life, and I am in shock, but he went, and it actually really helped him.
Oh my gosh. That's great.
So great. And, probably not a lot of men are listening to this. So we can talk maybe just for a second, like what are some symptoms that, men have that pelvic floor therapy might help?
I would say a common symptom that people think is normal would be like constipation.
Okay. Like
that in the classic, like my husband sits on the toilet for 30 minutes or an hour to have a bowel movement.
It's true. My husband does too. Sorry, wait.
So it's like, so, if they're actually sitting on the toilet because they're having problems with the bowel movement. But I've had quite a few male patients in the last few years with very severe, like typically it ends up being like a really, really severe issue where it's impacting their day-to-day life. Yeah. So
it's terrible being constipated.
Yes. So that is a huge, just life-changing, like for someone that's in a lot of pain from constipation or IBS type things. Yes. Like it's limiting what they might do in their personal life based on how their GI is that day. But we can help their muscles with coordinating a bowel movement, but also help them get in touch with other practitioners to help the gut itself.
Right. And one thing we can leave the men over there because this is like I guarantee no guys listen to it. I've had one guy say he listened to the podcast with his wife, and I was like in shock. Cool. I was like, wow, well, thank you. Like, sorry for all the stuff you heard about me. But with girls, so let's talk about it a little bit. So, what is pelvic floor therapy?
Yes, pelvic floor therapy is rehabilitation to the muscles in your pelvis that are basically in between your sit bones, in between your pubic bone and tailbone. So it's very specific, localized care to help with a lot of times bladder issues, bowel movements like we just talked about, preparing for vaginal deliveries, recovering from cesarean deliveries and vaginal deliveries, and in general, like back pain, hip pain, addressing that entire pelvis.
Right. And what I've learned from Amy, she's shown me like the models, like there's so many muscles in there, right?
Yes, there are.
It's insane. For me, like my muscles were so just constantly on like, constantly like flexing practically. And like, she was able to teach me like I got to like let go of, I guess, trauma and then relax those. And man, you feel like a different person in like all aspects of life. So it's just so insane that these muscles like can affect your life so much. It's incredible.
Absolutely. Most of my patients, I would say 95% of them, their muscles are constantly on.
Okay. Wow.
Or, yeah. Like constantly kegeled. That would be what most people are aware of. So most of my patients are constantly kegeled. And then our first session is always usually talking about how to relax them.
Mm-hmm.
A lot of times I'm like, I bet you've never done this before. You've never felt this. And they're like, absolutely not.
Mm-hmm.
I'm usually like holding my breath or my shoulders are tensed up. So
I know
like
that right now.
Yeah. And I think about that in myself, like, where would I be in my own body if I wasn't in this work? Mm-hmm. Like, what would my pelvic floor be like if I didn't know that this existed?
Right.
And when I first started in pelvic PT, my own experience was with period cramps.
Okay.
So in our training, we learn like, okay, if you have a client coming in with period cramps, it might be from this muscle being tense, and here's how you can release it on your own.
Wow.
And I remember like the first few months of working, my normal, I would say they were pretty mild period cramps came on. And I was like, I'm going to try that stretch that I'm supposed to tell my patients to do. And I did it. And then my cramps went away. And I was like, oh my gosh, this has never happened to me before. Like, I've never experienced no cramps.
Right.
Like, this is wild. So since working on my own pelvic floor and incorporating what I have learned, like, no longer have period cramps.
Right. So there's exercises you can do that, don't involve having, like you guys do, like internal work. Like there's stretches you can do. That's pretty cool.
Yes, absolutely. And breathing is a huge one.
Yes. Like not breathing, like, with your chest. We're not supposed to be, with your chest. It's supposed to be like down, from your diaphragm down there. That's one thing and it takes practice. Like when you're practicing it, that's what I learned from Amy. And it works when you're laying down, like, really thinking about it. It makes a difference in how you're breathing. Because sometimes I'll literally be holding my breath. I'm like, wow. Okay, take a deep breath. I'm like, I guess I'm stressed out right now. I don't know. But I love that. That is so cool. So period cramps, I also learned probably from y'all's Instagram. They're not normal. Like serious cramps are not normal. They're common. And so I love that there are ways like that, you can help. So people will have to go look at y'all's Instagram and see those little tidbits, or go see you in person and learn. But to relieve those, because I know a lot of girls have a lot of pain. Like my poor sister, she, just will cramp and just be miserable. I remember my aunt being miserable. And now knowing just that stretch could give you some kind of relief. Yes, I mean, that's absolutely a big deal, because they can be debilitating. One thing with pelvic floor that helped me was, before delivery. So going while I was pregnant, it helped me so much, like know how to push correctly. So do you have, any tips or advice, or can you explain how y'all help that out, getting ready to deliver?
Yes, absolutely. Mainly the breathing. So just like you were talking about a minute ago, a lot of people don't know how to correctly breathe, and we can assess a person and tell them their individual like cues to help breathing during delivery. So every person is different. So some people can walk into delivery and pushing is easier for them, but other people pushing is harder because they don't know how to breathe correctly. So when you come to a session, we assess your breathing and give you things to work on at home to work on the breathing. And then a lot of times with my patients, I like to write down like their specific cues for them. And that way, like their partner or their doula or their OB or their nurse can tell them like the direct cue that they need.
Right.
We also work on opening the pelvic floor muscles throughout pregnancy to make you more ready to have a baby pass through those muscles.
Right.
Versus, I know a lot of times people talk about strengthening the pelvic floor in pregnancy, which we do need strength, but we also need that mobility to allow baby to pass through easier.
Right.
And then postpartum, we work a lot on getting that strength back because your muscles went through a lot during delivery. And they need the rehab afterwards.
Right.
for me, I just delivered my baby 7 months ago. And I was just the whole time, even during pregnancy, I was like, this is so physical. Like, this is insane. How do people not have like physical rehab through all of this? Because it's so much.
So much.
How did you said you did not have PT before your first delivery?
Right.
How did you feel in the difference?
Well, it was a little hard to tell the difference because every delivery is so different.
Yeah.
And my first delivery or my first pregnancy, I did like over 40 weddings, and that's like 9 hours like standing. And I was an active person.
That's like 40 weddings is like 40 weeks.
Yeah. And photo sessions. I was crazy. Okay. I just didn't say no. And I was like, got to make this money, you know,
to get ready.
Yeah. And I'm like a workaholic. I do too much.
Okay.
But I was active. I was still playing soccer for fun. And so like, it was good for me to be active during my pregnancy. And I think that did help me a lot.
Yes.
But, and so like the delivery and everything was great. I got an epidural, but I could still feel what I was doing. It wasn't too strong. I could still feel the contractions a little bit, which wasn't comfortable. But when I was pushing, I could feel what I was doing.
Right.
And so it didn't take too long. Like, I had a wonderful experience. But then postpartum didn't have a wonderful experience. So then went to Amy, and she helped me out a lot. My body just, I had a lot of personal things going on, and I was just kind of holding tight. Yes. And it was like my body still thought the baby was in me, and it needed to hold her in there and protect her. And so, I was just wound up. And so Amy got me to breathe correctly. And, literally while she's working on me internally, I'm like saying out loud, she is safe. I am safe. Like, she is out of me now. And like, she helped me, like, my body realized, okay, you're not pregnant anymore. Cause it was like acting like it was pregnant still. And, it was crazy and I could feel, I just started bawling, crying when I released that. And like that muscle relaxed. And she told me that might happen. I was like, nah, I'm not gonna do that. Like, yes, no. I did. And it was just incredible. And yeah, I highly recommend it. So then I got pregnant very quickly. And I think I was 9 months postpartum. And it helped me tremendously with Raylan, my second pregnancy. He was a very big baby. And but thank God I went to her, because like every time I went, like, it was like I was back to being tight again. And it was like I just couldn't, my body just couldn't do it without getting actual help and her hands showing me where that tightness is. Because when y'all are touching the muscle that is constantly turned on, you can feel it, and you can feel it relax. So very thankful for that. And, every pregnancy is different. Everybody's body is different. Every situation's different. And then with his delivery, I was induced, and I guess he was like 39 weeks. And I don't say I regret it, but if I could go back, I don't think I would have been induced, because I don't think that boy was ready to come out. He was literally like sucking himself back in, and it could have been me, it could have been my muscles being like, nope, not coming out.
Right.
And then the epidural didn't work at first, and then he, I guess, fixed it, and then like it was way too strong. And that stinks, because I did all that work to do a wonderful job pushing him out, and I couldn't feel anything. Right. And so I just hoped, I hope my muscles just have muscle memory right now. But it was really hard to get him out, but I did finally get him out, and I'm proud. But it's just, thank God I still went to Amy, because it could have been a different story, but just the epidural, it was too much. It messed me up. Getting induced, it might make your labor last a lot longer than them coming on their own. Not like, I love that, we have medicine to where if someone is really in need of an induction, thank goodness for that. But sometimes I think it's unnecessary. I think it's kind of based on people's schedules nowadays. And I'm not in the medical field. I'm not looking at that every day, but just from my observation, I film a lot of births, and all my friends are having babies. It's interesting to me. And almost every single one of my friends that have been induced, it's been like over 24-hour labor or something, Right. What do you think about that? You don't have to share if you don't want to.
I was induced with my son, and my labor was like 36 hours. Yeah, it was really long.
Oh my God. Okay.
I was 41 exactly.
Wow.
41 weeks when he was, when I was induced. Yeah. And it was, but like at the same time, I'm like, okay, yeah, it probably was really long because my body went from not anything or like very small. Maybe I was having contractions, who knows? But like my body went from nothing to like having a baby. So part of me is like, gosh, oh my gosh, my labor took so long. Like most people should be under 24 hours or like, you know, all that. But at the same time, I'm like, oh my gosh, Ellen, like that was a lot on you and him.
Yeah.
But what I am very, very thankful for is, of course, like that I did pelvic PT throughout my pregnancy and I was able to relax my pelvic floor as much as I could. So,
Good.
And then also like my birth team, I chose my birth team based on if I was in that situation, if I was induced or if something did go, you know, not to the plan I wanted, that I felt comfortable in their care and their recommendations. Like I really, really thought about that a lot. And so when he was delivered, when my son was delivered, it was very calm and very in controlled. And like my epidural was really good and all of that. So yes, it was really long and it's not what I planned for at all. But like in the end, I felt like I controlled, you know, what was really important to me.
Right.
Yeah.
41 weeks is a long time. Yes. What do you think was going on there?
He just didn't want to come out. Like
I don't blame him.
Even at the end, like he still didn't want to come out. And I'm like, sir, like it's time. Like it's over 41 weeks. Like
so
it's time.
How long was it? Like, so did they have to break your water? Of course, probably, right?
Yeah.
How long were you in labor after that?
Time.
Wow.
Yeah.
Could you feel everything like, or did you get your epidural a pretty good time?
I got my epidural after like 24 hours. and then it was another 12. I got my epidural at 7 p.m. and then he was born at 7 a.m. Like exactly. Wow. Yeah.
Wow. So you probably thought his birthday was, you know, a different day.
No, my husband and I, we kept looking at the clock. And I'm like, oh, is he going to be, because the day I was induced, I was like, oh, this might be his birthday.
Yeah.
Like that was going to happen. But,
so funny.
And then the next day, and I was like, okay, maybe this will be his birthday. And then the next day.
Oh my goodness. Yeah. Well, you are a warrior. You look incredible. Wow. That is a very long labor, but like you said, thank goodness you were practicing relaxing those muscles and he came on out. And choosing your team is really important. Having support is so important and people that you trust because every delivery is different. Every labor is different. Like your next one might be totally different. Absolutely. You know, that baby might come flying out.
I love that. I would love that, please.
But yeah, so that is so important. And, did you have is Sarah Lynn your pelvic floor therapist?
No, my coworker Sadie.
Okay, I know Sadie.
Yeah, Sadie Hollis. There's two Sadies.
Oh, I don't remember what's her last name because she got
Sadie
married.
Wilkinson?
Yes.
Yeah.
She was in a wedding that I filmed.
Sadie Jones.
Yes,
Sadie Jones. Yeah.
She was in a wedding that I filmed and then I saw her with MOJO. I was like, whoa.
You're like, wait. I know her.
Because it was like an out of town wedding too. I was like, oh my gosh, that's so cool. Yeah. But wow, that is a crazy story. But now you got a sweet little boy.
Yes.
And how are you feeling postpartum? Like, did you just go straight to pelvic floor to get everything back to?
Absolutely. Yes. I was like, I need to come right now.
Yeah.
I feel good. Well, I mean, it took a while. That was something I was thinking about coming in today, like reflecting on my postpartum time and. I don't know. Part of me thinks it's because I'm a PT and I'm like really aware of my body or more than other people. Maybe I'm sure some people are aware too, but just like it was maybe 2 months and I was like, oh my gosh, like I still feel really weak and I still feel like really open was how I felt a lot. But I would say towards like the 3 to 4 month time, I was like, okay, I'm feeling really good. And then 6 months, I was like, okay, feeling really good. So I went on a run yesterday and I was telling my husband, like, I feel really good. And that's awesome. Great. Like, but just, I really gave myself time to heal and did a lot of resting and yeah, I was not pushing anything.
Good. No, our bodies deserve to rest. And what would you suggest? I know everybody's body's different, but what would you suggest to people? How long after delivery should people go in
to pelvic PT? Typically, I say 6 weeks.
Okay.
Yeah, similar to your postpartum OB appointment. I typically see people between 4 and 8 weeks. So sometimes they'll come see me before they see their OB, and that's completely fine too. Right. Especially if I've been seeing them in their pregnancy. I'm like, hey, just schedule an appointment for a month from now, and then I'll see you postpartum.
Right.
So
that's awesome.
But if not, then when you go to your 6-week appointment at your doctor, you can ask them about it for a referral or call. Yeah. Come in at your 6 week.
Yep. Yeah. Call MOJO. Yeah. You're at Sundara?
Yes.
Yeah.
I am. Yeah.
I'll be there tomorrow. I'm doing the hyperbaric chamber with Ease.
Okay.
Yes. Have you met them?
Yes.
They're awesome.
Love
Jasmine
them.
was just on my podcast yesterday.
Okay. Love it. Look
or 2 days ago.
Have you done the hyperbaric before?
Yeah. So I just did it for the first time last week. I've had such a weird, kind of headache for 4 months. It's weird. I just feel it right here.
Yeah.
And I don't know what it is. And so I'm like, all right, I got to figure this out. So I'm overly drinking water and electrolytes and trying to.
Oxygen change anything?
I literally got out of there and it was gone, but it's back. I feel it a little bit.
So go again.
I'm going again. Yeah. And it's kind of shocking that it one time made such a difference. I came out there, I felt like I was high almost. I was
see, I've never done that. Okay.
It was, I highly recommend it. The benefits are incredible.
Okay.
It's, the thing is some people are scared and claustrophobic, and I'm claustrophobic, but I knew I wanted to do it because I was I've got to figure this head thing out. I just feel I have major mom brain. It's crazy, the mom brain. And mom brain is real. You're you're hormonal, your 100%. Instincts are kicking in. Right now I constantly am hearing them. My kids outside right now. I'm but it's just mom instincts. But mom brain, it's a little too much going on for me. So I'm I've got to do something. So before I went in, this is ridiculous, but I've got postpartum anxiety that just has never gone away, and I'm working on it. Okay. But I told myself, I was I have to do this. If I don't do this, something bad could happen to my kids. I just I'm going to do this. You know what I mean? I was if I can protect it, like a superhero movie. But it was not bad at all. Okay. It is so easy. Try it. I can't wait to go in again. It's like getting on an airplane. They provide healthy gum for you. So I was chewing that gum. I'm going to post a video. I did a reel, so I'm going to post a video about it. But I'm in there breathing, chewing the gum because my ears started popping. But literally
interesting.
It fills up with oxygen. It's not 100% oxygen. I don't know the exact level.
There's some more pressure.
But it's pressure. Oh. And it just is incredible. So they recommend it to people, postpartum. It makes your healing faster. Yeah. So if you had surgery or something, they said they have a lot of people come in, postpartum, or if you had, breast construction or any kind of surgery, and so, or athletes, if they tear, ACL or something, they'll come in and do that. And also children who have sensory issues and, brain things going on, they will bring their children in there and they'll notice after 7 times a change. And I think that's incredible. I really want to try to bring my son in there with me. I don't know how it'll happen. I don't really let my kids look at my phone, but if I offer up my phone, maybe he would.
Let's look at
yeah. But it's incredible. So I would so recommend it. But I love that they have joined with you guys, because it's all my favorite healthy people bringing in this new holistic natural stuff. I don't know if you call it holistic, but you know what I mean. I just love it.
I love that they're there.
It's so awesome. So anyway, same thing. I went in back to Amy, and same thing with my body. I was just still holding that invisible baby in there. But when I went in, it took a while with my first to relax my body. When I went in, I relaxed immediately. Yes. Literally that first session. And so I just kept on going, and then I got pregnant again.
There you go.
And number 3, and I just think I didn't give my body enough, time to heal with those pregnancies. I just kept on getting pregnant, and everybody's different. Some people can go back to back to back and be great. Yeah. But with my body and the trauma it had, I just think I went too soon, and then I was working. I went and filmed a wedding 7 days after I delivered my first baby. That is absolutely stupid. But yeah, I could have had somebody shoot it, but myself, I was like, I got to do this. And when I booked it, in my head, I was like, I'm just going to be away from my baby for 9 hours. It's fine. I didn't want to be away from her for 5 seconds. So it was incredibly hard. And it really probably set me up for not a success postpartum mental health. But anyway, my body was just exhausted. And this third baby was just incredibly low. So I had to go in many times because I thought he was coming too soon. Okay. But Amy was there to help. But I mean, she would literally be like, I don't know if I can work on you anymore. Like early in the pregnancy, because she so felt low. Him. It was pretty nuts. But anyway, with my labor with him, I won't go into everything, but it was, I tore from the inside, like, and no one knew that it had happened. So I'm in this extreme pain, like, that I didn't remember from before, because it hurt, of course, before, but, the contractions and everything, but this pain was just like crazy.
During labor.
Yes. Like I went to the hospital and been like, all right, I'm about to have a baby, and when my contractions really started going, it was intense. And the only reason I found out that I tore from the inside was because Amy felt it at my postpartum appointment. She felt this giant scar tissue. Oh my God. Isn't that crazy? Yeah. So he just dropped very quickly. Wow. So anyway, but I literally inhaled and he came out. I was like, and when you inhale and like, that's kind of when you're pushing those muscles down there, because that's the correct way to do it, which not a lot of people know that. Man, I got him out.
That's amazing.
My doctor was like, oh, wow. And it was crazy. It was like almost too fast for me. I was almost like, I wish I could do a couple more times.
That was really quick.
But I'm telling you, pelvic floor therapy, I could feel what I was doing. That epidural wasn't too strong, and I could feel what I was doing. And so it was very painful, but I'm thankful that everything went well, and thankful that my body knew how to get that baby out.
Right. And that's how I feel about with my epidural, or my labor and epidural and everything. Yeah. Like the nurses, they were like, wow, like you're pushing really good and you are very calm. And I just felt like I was in my body, like connected to my body, and I knew what to do because I had practiced a lot. Right. Just like any other athletic, anything you're doing, like if you're running a marathon or if you're playing a sport, like you're going to practice those moves, and that's what delivery is. And
muscle memory. And like you said earlier, some people can go in there and push those babies out. Their body just knows. Already knows those muscles for them are ready to go, and other people not. And so I recommend it to everybody. Go in and at least once and let them tell you how to push.
Like, because and that happens, like I'll have someone push and I'm like, okay, that's great. Like I have nothing to tell you. But then a lot of the times I'm like, let's work on that. We're going to work on that.
That's so funny. Yeah. But and then I really need to go back to her. With my first two, the same thing happened to me. My hips turned in and my legs were turned in and my hips were uneven, and I knew it because I would make one wrong move and I would throw my back out, as you would say, and it was crazy. And instead of going to like a chiropractor to get an x-ray or CT scan, I just went to Amy. She fixed me that day.
Like, please, just fix
she was
me,
like,
Amy.
With my
You're like, okay, I'm great now.
Yeah, it was incredible. But
awesome.
Now postpartum, I might have the same thing going on, but my tailbone, it is nuts. Like I'm TMI, but don't care with pelvic floor therapy. Yeah. My tailbone is coming out. And so it's almost like you can feel like a tail growing practically. Like you can feel it. Like me just putting my hand back here, it's nuts. And so I don't remember what she called that, but we worked on it right after my third was born, and it pretty much adjusted immediately. Yes. But it's something that has to do with, giving birth or whatever, but it's starting to do it again. So I have really got to get back in there with
a little tune-up.
Yeah, it's a little tune-up with that. Another thing that I want to talk about, and it is, a personal topic. It's hard to talk about, but children do go in to see pelvic floor therapy or a pelvic floor therapist. And, some children, they might leak very easily or struggle with potty training. And it's so sad because sometimes their parents, might get frustrated, but they might have, a muscle problem down there. It might need a little bit of help. So can you kind of talk to me about that? Because I know would be hard for a parent to be like, okay, let's try that. You know what I mean?
Yes. And I see like teenagers, but I'm not a pediatric pelvic PT,
right.
but we do help with, there's a lot of kids with leakage, like when they laugh or maybe when they're jumping on the trampoline or even like at nighttime bedwetting. And we can help. A lot of it's like core coordination and even the breathing that we've talked about, like learning how to breathe and learning how to correctly activate the core would really help support the bladder.
Okay.
And then we do a lot of education on like bladder irritants or like almost like potty training, like when to use the restroom and how to use the restroom. And some of these things that we might just go through life like without thinking about, but we teach and educate patients and parents and the kids on like how to toilet correctly.
Right. That's awesome.
Yeah.
What advice can you give parents listening now about that?
Yeah. One thing that I feel like is big is once your child knows that their bladder is full or they're aware like that they need to go to the bathroom, we really shouldn't be telling kids to go to the bathroom. Okay. And I don't know the exact age on that. It probably varies, child to child, but especially once they're like 7, 10 years old, like when they go to bed or when you leave the house or when you come home or when you're going to run an errand, you shouldn't be saying, okay, go to the bathroom like before we get in the car.
Dang it. I do that every day.
Or maybe another way would be like, is your bladder full? Do you need to go? Maybe you could just say,
I'm going to switch that language up immediately.
There you go. Like, do you need to go to the bathroom? Because if they went 15 minutes ago and then you're telling them to get in the car and they go again 15 minutes later, that can actually teach the bladder to go like more often than it should.
Oh, wow.
Yeah. Right. So just rephrasing.
Yeah. That's incredible. Yeah. So I'm definitely changing. I'm like thinking about that right now. I'm like, I'm definitely changing that because my son, he has done such a great job with potty training and so quickly. And I think having a big sister helps probably too. Yeah. But we've been going through like, some, accidents.
Right.
And so I have been being literally like every 15 minutes, like, all right, go potty. And so I need to stop doing that. I'm causing this. I'm causing these accidents.
Maybe say, do you need to go to the bathroom?
Okay.
That way his attention can be in his body and like, instead of like, playing or he's distracted, like, okay, take a second. Do you need to go to the bathroom? Right. Yes or no? And then he would go.
Right. Yeah. That is great.
And same thing with adults. Like that's a lot of what I do as a pelvic PT with my bladder patients is, hey, you don't need to go to the bathroom every time you leave the house, but probably that has become a habit even from when you were a child from your parents, like telling you to go to the bathroom every time you leave the house. Right.
And I think some people just don't like using the bathroom other places too.
Definitely. And we talk about that. I'm like, hey, take some Lysol wipes, like just some like disposable pack. Like,
that's so funny. Yeah. It's so funny because I'm pretty good. Like I'm not someone that like has to constantly go to the bathroom or anything. Right. But if we're like on a trip, I'm someone who's constantly drinking water. I'll screw myself and we'll have to stop a million times because of that.
Right.
But my husband, man, he can go like all day without going to the bathroom. I'm like, wow, you've got a strong pelvic floor. You got a strong bladder.
Yeah.
I guess so.
The difference. You're like,
Yes. Well, speaking of husbands, talk to me about men sitting and peeing. That is the healthiest way for them, right? Everyone makes fun of them, but that's the healthiest way to do it.
Pelvic floor is most relaxed that way.
So it's the healthiest way.
It is, yeah. Because if you're standing, then your muscles have to be on to support your hips.
Right.
And like support your pelvis. But when you sit down, they can be more relaxed.
Right.
And that's how your bladder and your bowels empty the best.
Right.
Yeah.
So girls, tell your boys
so there
that
we go.
sitting and
I'm
peeing
sure
is the healthiest way to go.
I tell my husband. Hear that. What does he say?
He's down for it.
Really? That's great.
So, I mean, he doesn't always do it, but like he like
understands.
Before when I started getting into all this stuff, some people are like think this stuff is silly, But now he's just open to me, like talk about anything.
Like, sure,
he knows where I'm at in this little health journey.
What about your son?
He sits for sure.
Okay.
He wouldn't be able to reach
He's
the
like,
potty. He does not. He does not
Too
like
tall.
the little potties. So he's always sitting. My kids just never liked those little potties. They only liked the big one.
Real one.
Even not the little seats that go in there. I don't. Okay. Every kid's different. I don't know. And when we're outside, sometimes he'll be like, can I go pee on the fence or something? I'm like, yeah, sure. And he'll like squat down. It's so funny. But one thing that has changed my life that my sister told me to do, and I used to think, I was like, you are so weird. She taught me about the squatty potty, the like step stool. That is game changer.
Absolutely. We have a squatty potty at every toilet in our house.
Nice.
And I've definitely given them as gifts a few times. Actually,
so funny.
Went to one of those like favorite things, get-togethers over Christmas, and my favorite thing that I brought was a squatty potty.
That is hilarious.
And the person that took it home, she actually texted me last week and was like, "The squatty potty is life-changing." I said, "I know, that's why I brought it."
Yeah. I mean, it can save you from having to go get a colonoscopy or something, because so for those who don't know, squatty potty is like this little wooden stool or whatever stool you got. You don't have to buy that exact one, but it helps. Like when you're sitting on the toilet, your legs or your feet are on it and your legs are up, because, in other countries, they have those like holes outside and you have to like squat down and use the bathroom. That's actually the best way for you to number 2, because your like intestines and muscles work best that way, right?
Correct. Yes.
I'm like, not the pelvic floor therapist. You tell me.
Yeah.
You talk to me about it.
It's similar to what we were talking about with sitting down to urinate. So when you squat all the way down into a deep squat, your pelvic floor muscles are most relaxed. And actually, like through biomechanics, when we squat, the pelvic floor muscles open up the most.
Right.
So your colon becomes more straight to empty the stool out, versus it's kind of kinked when we're standing up, which is good. Like we want it kinked when we're standing, so we're continent.
Yeah.
And then when you squat, it unkinks. And especially like in Western cultures, our toilets keep getting higher and higher.
I know.
So that it's like we're just back to baseline with a squatty potty, basically. So the squatty potty helps a lot.
Yeah, that is awesome.
Raise your feet up.
Yes. What advice do you have for moms who are pregnant, who are struggling to get out of bed, struggling to get out of the car correctly? I mean, we've talked about this before when we made that video, but there are correct ways that can like help you tremendously. And you have to practice it so that you don't even have to think about it. But what are some things you could give advice to? I mean, it's not even pregnant people. Everybody should be doing it this way, but for those listening, I imagine, what advice would you have for people? Just simple things like that.
Yeah. One of the biggest things that I work on with all my patients is not holding your breath.
Right.
So a lot of times when especially people in pain are getting on and off my treatment table or standing up from the chair, they're just like straining, holding breath.
Right.
And I'm constantly cueing them throughout our session, like, okay, exhale or even inhale. Like, just don't hold your breath, because that's going to put more strain on your body and more pressure on your pelvis.
Right.
So even just breathe, like thinking about breathing as you move, breathing as you lift your kids up, breathing as you get in and out of the car, breathing as you stand from a chair. Like that is going to make a huge impact on your pelvis long term.
Right.
And then in pregnancy, keeping your knees closer together when you move. So when you're getting in and out of the car, instead of stepping one leg out to the side like you normally would, think about having a pencil skirt on, or like you're a mermaid, and rotate your entire body to get out rather than separating your legs. And then same thing, getting in and out of the bed. Like a lot of times we'll kind of like
fall out of the bed,
like fall out of the bed, or like, do something crazy to get in or out. But thinking about keeping the knees closer together, because that's going to decrease the strain through your pelvis and it'll decrease pain long term. And a lot of things with pregnancy is in my own pregnancy, when I started keeping my knees together, getting in and out of the car, I was like, this is kind of silly. Like, I don't know that I really need to do this. I don't feel pain. But once you get to that, like 32, 36, 40 weeks, like we want to keep your body moving as good as it can. Right. And starting those things at 20 weeks sets you up for the 40 weeks.
Right. And then helps you maybe not even have to think about doing it, know?
You're so right.
Yeah.
And going through pregnancy made me realize that too. Like you do have to practice, because it's, it's things you don't think about. Like you don't think about how you get in and out of the bed.
Right.
So when you retrain your body, it really does take like that repeated times. And then even like walking. I mean, being intentional, especially now that the weather's getting nicer, like going on walks 3 times a week, 5 times a week, really keeping up with your, heart rate and circulation and, trying to keep as much muscle strength as you can as you get further along.
Yeah, it helps. When you're active, it really helps you.
It really does.
Even if you have a long labor, it does help you in the end.
Yeah.
And doing all these things helps you long term too. Because, there, I thought he said mommy, but nope, he's got a hose and he's good. There's a lot of different doctors. There's a lot of different specialists. There's a lot of, it's like one person can have 10 problems going on. If we can learn these things, and they're simple things that people might think are silly, we can help avoid this and have a less painful, easier, healthier life. And so these things are just so important. Literally just keeping your knees together while you get out of the car. That is so important. I've got to do that. Like you said like, that okay, in a video and I videoed it and I'm not doing it. So literally I'm sticking with 2 things that you've taught me today for sure. Good. I love to talk a little bit about something that is just rising, which is infertility, which is a very, just heartbreaking thing that a lot of people are going through. I hear that, pelvic floor therapy can help infertility. And, I'm not saying like go and then you're going to get pregnant tomorrow. Right. It takes work, but talk about that a little bit.
Yeah, absolutely. Our ovaries and our uterus they're organs. And for organs to function best, they need blood flow. They need, a normal amount of blood flow. And the blood flow can come from our muscles pumping the blood to the organs. And the ovaries and uterus, they sit in the pelvic floor, and part of the pelvic floor's function is pumping fluid, whether that's lymph or blood, to our organs and also out of the pelvis. So like you were saying earlier, your muscles being tense all the time, that's going to keep your muscles from pumping the blood correctly.
Right.
So sometimes that can lead to swelling. If they're not pumping enough, we can actually get like pooling of lymph and blood in the pelvis. But other times we need more blood in. So when we work on the pelvic floor, we're helping the muscles be able to contract and relax like they should to help with blood flow. Another thing would be like even your cervix dilating. Like, can your cervix open enough during ovulation to allow sperm in?
Right.
And the cervix is surrounded by the pelvic floor, and we need that to be correctly or normally mobile, through your cycle. Another thing that we work on, we actually have a few therapists that are specialized in fertility support, and they work on the mobility of the uterus itself, of the ovaries through fascia connection, ligament connection, but they've gone through specialized training to treat that.
Wow.
Yeah.
That's crazy. That's a lot
really
of information right there.
I know.
Wow.
That's a lot. Yeah.
Everybody, pelvic floor therapy, that's incredible. I didn't know all that.
I know, it's crazy.
Our bodies are amazing.
Another thing like with fertility in my patients is I feel like as a pelvic PT, I'm seeing my patient regularly, for 6 months or sometimes a year. And I'm able to listen to what their other providers are saying. And if I have someone that is trying to get pregnant and sometimes I feel like they don't have a plan from their doctor. Mm-hmm. And if you want to get pregnant, like there should be a very concrete plan 100%. On like what to work on. And that is a big thing. I talk with my patients about, like, if they come back and their doctor hasn't given them a plan, I'm like, hey, I really think you might get a second opinion.
100%.
If there is a plan, like you need a solid plan.
Yes. Your doctor is so important, and there are amazing doctors. I'm so thankful for my doctor. She just, like I've said this, like just hearing her voice, like while I'm in labor, her voice coming in, I'm like, oh, I'm safe. You know what I mean? It's just good. Very important to feel comfortable with your doctor and feel cared for, because they do have so many patients. They are so busy. I don't know how they do it. Like when they have kids, I'm like, how do y'all do it? Y'all are incredible. But it is very important to feel comfortable with your doctor. And if you're trying to get pregnant and you know, I've had a friend, let's say that they've had a few miscarriages and they're, you know, pushing their 40s. They're like, I'm ready to get pregnant. What's going on? And if their doctor's like, oh, just keep trying. I think it's time to get another opinion.
Yeah.
You know, you don't have to feel stressed and in a rush, but let's have someone help you out. Maybe get some tests done and that's awesome that you do that. Y'all are like therapists. Seriously.
We see our patients, you know, regularly.
Yeah.
And that's another thing in pregnancy that I reflected on was I'm getting to see a healthcare provider like once a week or once every other week in my pregnancy, which is nice because I'm getting, if there were any like red flag, anything, like I'm in touch with someone in person often that knows my body and like knows what I was feeling like 2 weeks ago.
Right.
Versus my OB appointments are so spaced out until the very end. But it was just nice to have like another touch with healthcare providers to check in on all that.
Yeah, that's awesome. When you are pregnant, I can't remember, I can't remember if she was like working on my tummy. Do you like work on like the outside of the body, like when people are pregnant? Like, are there exercises that way?
Yeah. I don't work on the abdomen itself because of the uterus, and I don't want to mess with the uterus at all externally. But I work on backs all the time. I mean, there's so much back pain.
Yeah.
There's so much strain on your back. So I usually am working on the pelvic floor internally or the back externally.
Okay. Like sciatic nerve pain. Like, can y'all help with that?
Yes.
That is huge.
Absolutely.
Like everybody's having sciatic nerve pain. Okay. Well, everyone, pelvic floor therapy.
And actually, Sadie, my PT, she'll find this funny. I was having like some left hip things in my pregnancy.
Okay.
And it felt like my sciatic nerve.
Yeah.
And she touched one of my glute muscles. I was like, Sadie, that's my sciatic. And she was like, Ellen, this is your glute muscle. I was like, okay, just you work on that. I'll be right here.
That is too funny. Yeah. That's exactly the pain I had. Because I was like, I guess I have sciatic nerve pain, but no, it was my glutes.
Your glute. Yeah.
That's interesting. And so, wow, everybody's got to come to you guys. That's incredible. What else? Like outside body, like sciatic pain, like exactly. What other things, symptoms or?
A lot of people have hip pain, SI pain, pubic bone pain. SI and pubic bone typically is when you're like going up and down stairs or getting in and out of the car.
What's SI?
Sacroiliac. It's a joint. It's low back.
Okay.
But it tends to be like sharper. Did you have any like pubic pain?
Oh, yes.
Okay. So it's similar to that, but it's at your low back.
Yeah.
So it's like tends to be with movement, getting in and out of the car, stairs. I dry needle. Have you ever been dry needled?
Is that the same thing as
acupuncture?
Yeah.
It's similar.
Okay.
But I am inserting the needles into muscles.
Wow.
And releasing the muscles with the needles. So I have been needling a lot of glutes in pregnancy, and it's gone really, really well. Yeah.
That's incredible.
Yeah.
Okay.
And
Can you talk to me about that?
Yeah. You're like, talk about it.
I'm like, wow.
The glutes, honestly, the glutes and the pelvic floor to me are very similar to each other. Like if the glutes are tense, then a lot of times the pelvic floor just like follows that tension, or vice versa. Like if pelvic floor is tense, the glutes tend to be tense with it. So what I have found is needling the glutes helps the pelvic floor relax because now they're both like, okay, I can like chill.
Wow.
If I do internal and release the pelvic floor, but the glute is still tense, then that pelvic floor is probably like feeling what the glute is doing. So I'll do internal and then needle the glutes, and it just.
Oh, I thought you were gonna say the needles.
No,
I was like, whoa.
No.
Okay, no.
No needles internally. No. But I do like internal treatment of the pelvic floor, and then needling the glutes together, and it has been really helping my patients a lot.
That is awesome.
Yeah.
Did you like come up with that yourself? Or did you just learn that? Okay, I was like, wow.
No, it's like a continuing education.
It's called dry needling.
Dry needling.
Wow.
Yeah, and you can needle anywhere in the body.
Right. Yeah. And whenever people are doing that, is it just in your muscle?
Yes.
Okay.
Yes. Only in the muscle where, like, you know, you have knots in your like upper, like your traps.
Oh, yes.
Yeah. So I'm inserting the needles into those knots to help them release. And then postpartum, honestly, my patients that I see in pregnancy, a lot of times they're doing really well postpartum because we've worked on their pelvis so much in pregnancy. So then I end up like treating their upper traps and like neck from breastfeeding and holding baby.
Yes.
Yeah.
Wow, that's so fun. That is awesome.
So a needle
I've done acupuncture before, and it was a crazy experience. Like I guess she just did it like on the front of me, and I was like so tense when she was doing it because I think I was like kind of scared.
Nervous, yeah.
And then I like finally relaxed, and like when I relaxed, tears just started flowing down. I was like, I don't know why I'm crying, but I'm crying. So it really does. I wish I had like really stuck with it, but it really made a difference. That is so cool.
Yeah. If you want some needling,
I'm coming in.
Schedule.
I'm ready. I'm ready to get, back to feeling good. I'm in tune with my body as well, like you are. And, now learning all these things, it probably makes me even more in tuned. But I know that these pregnancies have really taken a toll on my body. Of course, it takes a toll on everyone's body. Yeah. But, I do take a pretty good job taking care of myself. But there's just some things like the needling and pelvic floor therapy, you need it. You need it. And you need the right advice to know exactly what's going on, because you guys.
I just really think that every pregnant person needs to go to pelvic PT.
Yeah.
Because it's so physical. And even if you just get an assessment, or even if you go to one session, I do an assessment and I give you 3 things to do in your pregnancy. Like because you need like care specific for you rather than just like prenatal yoga on YouTube. Like it's great to do that, but you also need individual care for yourself to set you up even better postpartum. Like you and I have both mentioned like being active and working out in pregnancy is huge to set you up for postpartum, which is true. Yeah. And also like your mobility and being aware in your body in pregnancy sets you up for that postpartum.
Right.
And I see that in my patients all the time. Like when they go through PT in their pregnancy, their postpartum like goes really, really well.
Yeah.
And then sometimes my patients that come in that haven't been to PT in pregnancy, like we're working through so much more because we're like starting from the
that was me.
Starting from the beginning. Yeah.
That is so true. I wish that it was like a requirement for pregnant people. Do you think that would ever happen, or are pelvic floor therapists like trying to get that to happen?
Well, Amy has a research study going right now.
Oh, wow.
Did you know that? Yeah.
I don't think so, no.
Yeah. There's some research going right now because there is not a lot of research, and we need research to get in like to the doctors. Okay. So if you compare birth to like a knee replacement, right now it is required that you go to PT before your knee replacement, like prehab, and then it's required that you go after. Because there's a lot of research on it.
Right.
So it would be great, for us to have research to show that there's benefit, and we are doing that right now. I'm sure it'll take amazing. I know, it's so good. Wow. Yes. It's amazing. Really, really needed too. Yeah. So there's research going on right now that will, I'm sure it's going to take a little while, but just the more that people that have been in pelvic PT can talk to their doctors about their experience, that is the biggest thing I think right now that will affect things. And I tell that to my patients a lot. I just had someone this past week deliver her second baby. She did not have PT before her first, and she was just like raving. Like she was like, Ellen, this experience was so much different. Like I was so much more connected to my body and I was able to push, and like it was great. And I said, please tell your OB that, because they need, the more that they can have other patients with that experience would be great too.
Yeah. I film births, and I'll hear some doctors be like I can tell when a woman does pelvic floor therapy.
Oh, that's great.
Yeah. And sometimes women are just a little badass and just get them out. Like I said,
sometimes you just do that.
Yeah. But they can almost tell because those muscles are so different, and that's incredible. It is so important. I did think about this. I wanted to talk to you about kegels because it's so funny. People will say, after they have a baby, like, I'm doing kegels, blah, blah. And sometimes I can't say, I can't comment on everything. But in my head, I'm like, you might be hurting yourself because you might not need to be doing, I don't know the right wording. Can you talk about Kegels for a second?
Yes, absolutely. It's so hard for me to like say everyone should do them or everyone shouldn't do them. Like they are a muscle and they need to be worked out. Like they need to have strength. And a lot of my patients, they have really weak pelvic floors. So we are working on strengthening their pelvic floor. But a lot of the times our muscles are too tense, like we said. So if they're already tense and then you go strengthen them, like they're probably just going to get more tense.
Right.
So what I would recommend is doing more hip strengthening, like glute strengthening, like bridges or lunges, or working on strengthening in that way versus like just an isolated Kegel, unless you have been to pelvic PT and gotten your assessment. I just recommend doing other things.
Yeah. 100%. Because I thought that was just what you needed. And Amy just kind of like, no.
Yeah. Sometimes every once in a while I'm like, by the way, do not do Kegels. Like if my patient is like so tense, like so tense, me. I'm like, just so we're clear, like don't do Kegels.
Yeah.
You know, we have to be specific.
Exactly.
Also, you never know. Like some people just do them, at stoplights or, every time they go to the bathroom, like they're doing them. So we have to.
And I want to ask this question. This might be weird.
Yeah.
When I like, there's, so many reels out there. Sometimes it's so overwhelming and too much information or just not the right information. Someone posted something like, when you are going pee and you stop in the pee again, that will help straighten the blah, blah. That's not good.
No.
Okay.
No.
That's not good, people.
No. Do not do that. No, we should not Kegel when we pee because that's when our muscles are supposed to relax.
Right.
So, and like over time, over decades, if you're doing that every time you go to the bathroom, that will affect your muscles.
Yeah.
Same thing with anything we do. Like any way we move over and over and over again is going to affect our body. So if you're contracting your muscles every time you pee, like your body is going to learn that.
Right. Not good.
So just relax.
Yep. Don't do that.
Contracting.
Don't listen to that reel. And this is the last thing. Sorry, I could talk to you forever.
Oh, yeah.
And it's a huge thing. Painful sex. That can really hinder relationships, marriages. But it can be fixed. And pelvic floor therapy is the answer.
Yes. I have a lot of patients with painful sex and a lot of patients coming to me with that is their only, like that's the only thing we're working on.
Right.
And a lot of the times it's the tense muscles. And especially in this area of the country we're in the South, we tend to have some, religious things or even just the culture of like, this is my body, which it is, and I need to protect it, which we do, but also learning that there's times where it doesn't need protection or you do feel safe and you don't have to protect your own pelvic floor. And learning, again, it's back to like learning how to control your own muscles and relax them when you want to. Right. And contract them when you want to. Right.
Because, it's also a mental thing too. You may not even realize you're doing it. You may not, like in that moment, like if, you're with your partner and, you want to have sex, but it hurts. You're like you said, you're protecting yourself.
So if it already hurts, like if the first time you have sex, it hurts. Then why would your body want to do that? And the response to pain is to contract and protect. And that's just probably going to make the pain worse. Over time, especially. Like it's not, your body isn't suddenly just going to be like, oh, okay, like I'll relax now.
So when you go into pelvic floor therapy with that, is it just kind of the same thing you're helping them teach themselves to relax in these moments?
Yes.
Are there key things you tell them to be able to do like in the moment or A
lot of times we talk about positioning, like based on what muscles for them are tense or like a lot of times it's a specific muscle that is causing the pain. So once we find that muscle, I can give them ideas on positioning for that way that muscle isn't hit as easily. Give them like breathing exercises and stretches. And a lot of times I'm talking with my patients about, okay, before, I know this is like crazy, but before you have sex, like you're going to need to warm up your muscles just like anything else, like just like the marathon or like the athletic event you're doing. Like, you don't just suddenly go from sitting down to like running a marathon.
Right.
Like, you stretch and
Right.
even like increase water intake. I was just talking to someone this past week, like, who has some vaginal dryness, and that is painful during sex. I'm like, hey, how much water do you drink?
Yeah.
She's like 2 glasses a day. I'm like, okay, well, let's increase
Times
that.
by 10.
Yeah. To help with like moisture in
Yeah.
the tissue and like your tissue quality. So we're not so much a pelvic PT isn't even just the muscles. It's like much more throughout, the rest of their body and their life. So giving them ideas too. And a lot of it is talking with that person on what they want. Like, not every person wants the same thing, and not everyone wants the same thing out of therapy. And especially at MOJO, we really specialize in that individualized care and like listening to the person in front of us and catering to them.
I love that. Y'all are awesome. I'm so thankful for y'all, and I know a lot of people are. Y'all have changed a lot of lives, and that is so cool. Y'all are therapists. It's so funny. You're giving people sex positions.
Exactly. There we go.
It's awesome. Well, everybody go to pelvic floor therapy. Be assessed. Y'all do take insurance now. Y'all have been for a while, but when I first started, y'all weren't. So it's incredible.
Good.
So thankful for that. And I'm telling you, y'all got to go. Y'all got to go get assessed. Call MOJO, Sandara, see Ellen.
Good.
She's also, you're back at work, right?
Yes. I'm back at work, seeing patients, loving it. Like, I just love my job so much. And I was really excited to get back and see my patients.
That's so special to love your, what a difference in life, just to love your job.
I know.
It's awesome.
Well, so thankful.
Yes. Well, I cannot thank you enough for coming on here. You'll have to come on again.
Yeah.
I want to hear more about this research. That is so cool. That is huge. Like this could be a game changer for the country. I feel like.
I know. It needs to happen. It's really cool.
And like, I hope our country with our health is going in a positive direction. This would help it. This so there's a lot of pregnant people out there. This would help so much, and postpartum can be life-changing, and this would help with that too. Like, that's just amazing. Well, thank you for coming on. You're gonna have to come back on. Yes. I really want to buy more mics. I'd love to have a friend of yours or another pelvic floor to come on and just talk more. That'd be awesome. But thank you so much. You're the best, and you did incredible. You're very good at explaining everything, and good. Thank you so much.
One mom brain episode.
Yes, one mom brain episode about pelvic floor therapy. Well, thank you so much. I appreciate it.
Now this one's for the brothers.
Local Mortgage is a proud supporter of Camilla Proctor and her Camilla the Momzilla podcast. Local Mortgage is a family-owned mortgage company in Memphis, Tennessee. Our family knows how important a home can be to your family. When it comes time to buying your first home, or if your family size has outgrown your current house, we have the experience and expertise to help you. On top of 50 years of combined experience, we also offer rates that are consistently below the national average, helping to make your new home more affordable. You can see current rates, calculate payments, and learn all about home buying at localmortgage.com. When you are ready, we are here. Local Mortgage is an equal opportunity lender licensed in Tennessee, Mississippi, Georgia, Florida, and Colorado. NMLS number 1855068.
Are you thinking about buying or selling a home? Let's make it happen. My name's Emma, and I'm a real estate agent here in Memphis with Coldwell Banker Collins Murray, and I'm here to guide you every step of the way and would love to connect with you. Give our office a call at 901-259-8550, or you can reach out to me directly at 901-592-8149. I'd love to help you get started and help with all your real estate needs. Talk soon.